Hi friends, Namaskar. At this point in time, the lockdown is quite an essential to break the chain of transmission of ncovid-19. But the question is that what would be the exact requirement of testing devices in coming time? What would be the rate of transmission of ncovid in coming month, and what would be the variance of rate of transmission of ncovid-19 in the population and in different areas? So where, when and whom? This is the requirement to know, to make certain policy, to make a specific decision to curb ncovid-19 disease in shortest time. So friend, for this, the top health organization of India is going to study, or even they initiated to study data history of this ncovid-19 virus, and they are going to employ certain statistical tool to study these things, to find out exact or appropriate conclusion, to make decision for curb this disease. So what would be the exact measure, and what really the Indian government can do to curb this disease as soon as possible? This study can explain all things. So in this video I am going to just brief out some important aspects of this study, and what the ICMR, that means Indian Council of Medical Research, is going to study. Actually already many countries have studied the ncovid-19 infection, and they have analyzed the data history of ncovid-19. So in many countries they have found the worst and best condition, and in that condition what would be the government requirement, they have already planned for that. So as for example, Indonesia already done this type of prediction by utilizing the geometrical sequencing statistical tool, and Indonesia has already just announced that they are going to have till the end of April month minimum 11,000 and maximum 71,000 cases. And according to that, because they have already assessed by the data history analysis of this disease, they can plan that this much requirement for facilitating health care to the patient and curbing this disease in the coming time. So ICMR also is going to study the data of ncovid infection by the method of mathematical modeling. So what exactly is mathematical modeling? Actually, in mathematical modeling we can figure out how many cases India could be grappling with in the next few months. It will estimate the transmission rates of the COVID-19 virus as well as variance of transmission rate over time. So what would be the benefit of that? By analyzing the data by this method, mathematical modeling, the epidemiologist could say that this will be the exact or appropriate data for the certain requirement in the healthcare, like testing devices, like ventilator, like hospitals, laboratory setup. As we all know that ICMR has already 111 laboratory in the India, and they all are functioning 24/7, and they have capability to assess, test on daily basis in thousand. I think it's almost 10,000 to 11,000 per day they can assess, test for ncovid. So in 1 week they can assess almost 60 to 70,000 tests in their laboratory. So it's good, but this study is really very much needed to assess the exact requirement for the health care of the patient who are going to infected in the coming time. And as we also know these things from the other countries like South Korea, China, they have done the aggressive testing for the ncovid infection in the population, and by doing that they almost able to curb this disease or just sustain this disease in certain locality or in the certain number of infected people. So in India it's also very much needed to study these things. The data should be analyzed, and according to conclusion of data or after interpretation of data history of ncovid-19, the policymaker can make different decisions to curb this disease in time. So friends, please have a great hope and pray to the God that this disease just finished out as soon as possible, with all the positive thoughts and hope, and one very much fighting spirit that we will win this hurdle and we will certainly come out from this difficult phase very short time. By having this hope, I just want to say you have a wonderful time ahead. Namaskar. Thank you.